More people die from overdose every year in America than do from car accidents. Overdose is the #1 cause of accidental death in our country, in our state, and in our county.
To put that in perspective, 80 individuals are dying every single day in the United States from an opiate overdose. That's 3 people an hour.
We have seen a 4-fold increase in the rate of death due to overdose from opiates since 1990.
And it's not about just heroin users. It's not just about a fentanyl user. It's about mom or dad who was in a car accident and is given 2 or 3 medications plus a muscle relaxer and something to help them relax. And all of a sudden they're not breathing at home. They didn't take too much medicine. It was just more medicine than their body could handle.
It is everywhere. And working with people, I have a lot of people say, oh, I don't know anybody who uses heroin. But if I ask them about, well, do you know somebody who has prescription drugs? They're like, oh yeah, all the time.
Yes, people are overdosing on heroin, and slightly more are starting to overdose on heroin. But the vast majority is still prescription medications.
Fortunately, there is a medication that will safely and easily reverse any opioid overdose, and it's called Naloxone.
So naloxone hydrochloride is pretty much a pure antidote for opiate overdose. It was created in the 1960s. The FDA approved it in 1971.
Since roughly 2000, there have been organizations across the United States that have started distributing naloxone rescue kits to community members like you as a strategy to reduce overdose fatality.
Out of the 3,150 individuals that we've trained to use naloxone, 365 times somebody has come back to us and reported in person that they've used this medication to reverse an overdose.
In this upcoming video, we're going to train you how to use a naloxone rescue kit. We're going to train you how to save a life.
Naloxone is important for anyone who uses substances or has ever had a history of using substances, including people in recovery. Even for people in recovery who, sometimes the thought is that I'm never going to return to using again, so I don't need this. Because of the recovery community, it's really important that we all know how to use it because people are going to return to using around us all the time.
In recovery, a lot of times relapse is part of the recovery process. People try to stop using drugs, they relapse, they start using again. That doesn't have to be the end of the recovery process.
Because addiction, substance use disorders are a chronic relapsing disease, we know that can happen. And so we need to equip our individuals who are in recovery with naloxone. If they do relapse and they do overdose, they need to have that around to help save their lives.
I feel like everyone who knows someone who is using opiates of any form should have a kit.
So what is an opioid? Opioids are substances derived from the opium poppy, or with a chemical structure resembling it. Opioids can reduce pain and produce feelings of euphoria.
I think it's important to know that opiates is not just heroin. Opiate overdose is not just heroin. It can be a multitude of opiate medications where there's Vicodin, there's Norco, there's Oxycontin, there's fentanyl. There's all kinds of opiates.
So what are some common opioids? There's heroin, Vicodin, Norco, Oxycontin, and fentanyl. But there's also Percocet, Dilaudid, methadone, Demerol, codeine. The list goes on and on.
One of the key things to remember is that when somebody's using an opiate, whether it's legitimately as prescribed or if it's being used illicitly, they can still overdose. So anybody who has a prescription for an opiate should have access to this life-saving medication.
And naloxone hydrochloride is a medication which was designed specifically to reverse an opioid overdose. That's its sole use in medicine. It's very, very effective, very efficient, and very, very safe.
If somebody uses too much opiate, whether that was on purpose or accidental, then this medication can be given to reverse the overdose.
So when we take opiates, they target these receptor sites in our brain, and they tell our body to do certain things. They tell our body to feel pain relief. That's why they're, effective pain relievers. They give us that euphoric sensation, which is why so many people struggle with addiction. They tell our body, to start, slowing down our breathing a little bit. These are the natural responses our bodies have from opiates. When somebody overdoses, essentially our brain is telling our body that we have enough oxygen. You don't need to breathe anymore. So what naloxone does is it targets those same receptor sites, but it binds to them with a higher affinity than what opiates do, essentially kicking the opiates off those receptor sites.
It can be used on anyone that it looks like they're overdosing, and it's a medication that will not harm you. So if you used it on me right now, it wouldn't harm me.
One of the things that people need to understand about naloxone is that it will work on all opioids, any opioids, but only opioids.
If someone is using multiple substances, it's going to help you come out of the overdose for the opiates, it may not for the other substance, but then you're able to better evaluate the situation and see where to move from here.
If it's given to somebody who is not suffering from an opiate overdose, somebody who is not opiate dependent, it's going to essentially be like giving them water.
So it's an amazing drug, really. It's one of those where you can see somebody that looks like they're dead or near dead, and you give the drug, and they're better. And there's not too many things in medicine to do that.
It's clear people can and do overdose on opioids. So what puts someone at increased risk?
So some of the things that put someone at a higher risk of overdosing are mixing. When it comes to a mixed drug overdose, there's kind of two different classifications. There's when you mix an upper and a downer. So that would be like methamphetamine and prescription opioid. And then there's downers and downers. So a benzodiazepine like Xanax or Klonopin mixed with an opioid. It's important to avoid mixing drugs for that reason. Another risk that can increase someone's risk of an overdose is tolerance. And it's not so much having a high tolerance, but when someone's had some sort of period of abstinence, whether it was jail or rehab, or they just chose to stop using drugs for a while, and then they return to using drugs. A lot of people know that their tolerance is decreased, so they'll use like a little bit less, but what a lot of people don't realize is that it decreases by a lot more than they realize.
Don't do the same dose that I did 90 days ago, or I could potentially overdose.
Another risk that increases the likelihood of someone overdosing is the quality of whatever they're taking.
Unfortunately, heroin changes from day to day. Nobody knows what you're going to get. It doesn't come with nice little baggies with the contents, what's cut with, how much to use. And so somebody using something today could be very different from what they used the day before. We're seeing a lot more heroin that is being cut with fentanyl, a very potent opioid.
Sometimes we see pure fentanyl or the fentanyl analogs, sometimes pure heroin, or a lot of times a mixture. And the final issue is a lot of people think they're buying heroin and they're getting fentanyl.
With prescription opioids, we also talk about quality because not everyone knows the difference between a Vicodin or an Oxycontin or a Dilaudid. And so it's really important to know the different strengths of these medications, that even at the same milligram amount, they can be significantly stronger. And then also knowing the difference between, a 10 milligram pill versus an 80 milligram pill and recognizing the difference between those. And then the last risk that we talk about with overdose is using alone. Obviously, using alone doesn't increase someone's risk of overdosing, but it can increase their risk of it being fatal.
When using, you have to have people around you. And it's really outside the box thinking to say, if you're going to use, let people know you're using.
We now know what's going on in our community concerning overdose. We know about overdose and naloxone, and we've heard about overdose risk. Now we're going to show you how you can respond in an overdose situation.
So somebody who looks like they're going to overdose or is overdosing will start to have shallow breathing. They may have blue lips.
Tiny pupils, nodding out.
So they kind of start making this snoring noise, and that's kind of one of the giveaways that they're ODing.
People will breathe slower when they're really high, but it can be hard to tell when that breathing has gotten too slow, and so really the only thing that really separates those things is whether or not that person's responsive or not.
There's a whole range of symptoms that can look very similar if somebody's overdosing or if somebody's just very intoxicated on opiates. The thing we're looking for is if somebody is unresponsive. So, give somebody a little shake, say their name, you're not getting any response.
For most people, if an overdose is occurring, they've learned from other people who are overdosing how to respond. Slap them around, put wipes down their pants, drag them in the shower. Those are all time wasters when somebody's overdosing.
The way we teach people to respond to overdose situations is using the 3 A's: assess the situation, administer naloxone, and aftercare. We want to assess the situation to see if someone is overdosing. We want to administer naloxone to keep them alive. And then comes aftercare, providing rescue breathing, calling 911, and seeing whether another dose of naloxone is necessary. The first step in the 3 A's is assess. We want to determine if this individual has overdosed. There can be a lot of signs or symptoms that someone has overdosed. Their eyes could roll back. Their lips could be turning blue or purple, pale or clammy skin, vomit, foaming at the mouth, gurgling or snoring sounds. But the 2 key points are whether or not they are unresponsive, or whether there is slow or no breathing. To see if this individual is overdosing, we want to see if they're responsive. A good way to tell if someone is responsive or not is to do a sternal rub. A sternal rub can cause a lot of pain without causing damage to the individual. Suspected opioid use plus non-responsive and slow or no breathing equals an overdose. You can call 911 at this point. If you are by yourself and a phone is not easily at hand, move on to administer naloxone.
Yeah, I'm with my friend. He's not breathing.
Someone dies from an opioid overdose because of a lack of oxygen. And even a few minutes without enough oxygen can cause irreparable harm. After we have assessed the situation, and we have reason to believe that someone is overdosing, we move on to the next step, administer naloxone. Again, we are going to teach you how to administer naloxone in its 2 most common forms, intramuscular and intranasal.
The Narcan comes in single vials. You just pop the orange cap off, you use an intramuscular syringe that we provide, withdraw the Narcan, and inject into a major muscle, into the thigh, to the butt, or into the shoulder. The muscular injection is going to take 3 to 5 minutes to kick in. In that time, you want to continue breathing for the person, making sure they're getting oxygen.
Intranasal naloxone comes in these pre-assembled nasal delivery devices. It is very easy to use and to administer. The first thing you will want to do is lie the individual on their back if they are not already. Tilt their head back slightly and gently press up on their neck. Wipe off their nose. You are now ready to administer your naloxone. Again, these devices are very simple and easy to use. Open up your cardboard box, pull out 1 blister pack, rip open the blister pack, removing the device. Grip the device with your pointer and middle fingers on either side of the nozzle and the thumb on the plunger. Really, the only way you can go wrong is by trying to prime or pressing the plunger too much prior to getting it in someone's nostril, thereby wasting the medication. Insert the nozzle fully into the individual's nostril until your fingers are touching the bottom of their nostril. Gently but firmly depress the plunger, releasing the entire contents of the device into one nostril. Naloxone takes 3 to 5 minutes to work. In that 3 to 5 minutes, the individual may not be breathing fully on their own yet. The third A is for aftercare. There are 3 important things you must do after you have administered naloxone. Call 911 if you have not already. Continue rescue breathing. Evaluate the situation to see if another dose of naloxone is necessary, and support your friend.
When someone dies from an opiate overdose, they're dying from respiratory arrest.
Their brain is not allowing them to be receptive to taking enough oxygen. Their muscles are so relaxed, they're not taking in enough oxygen. And if they just are doing rescue breathing and calling 911, there's an opportunity to save a life.
Rescue breathing is very simple. You lay the person on their back, you tilt their head back, open their mouth, pinch the nose shut, make a good seal between your mouth and their mouth. You give 2 breaths, you count to 5, give 1 breath every 5 seconds thereafter.
After 3 minutes, if the individual has not come out of the overdose, meaning they are not yet responsive, administer a second dose of naloxone, and continue rescue breathing. If after 2 doses of naloxone they are still not responsive, this may not be an opioid overdose. Make sure 911 is on their way, and continue caring for the individual. Many people are scared to call 911 because they are worried about getting arrested. In Michigan, many of our law enforcement officers are now equipped with naloxone rescue kits and carry them in the community. In Michigan, we also have new Good Samaritan legislation, which protects you and the individual who has overdosed from arrest for personal use amounts of controlled substances, as long as the evidence was gained as a result of your seeking help in the overdose situation. Fentanyl is an extremely potent opioid. It can be thousands of times more powerful than heroin. Fentanyl can be dangerous either prescribed by a doctor or when heroin is cut with it, and people unwittingly use it. It is very difficult to differentiate between heroin and fentanyl outside of a professional laboratory. In a fentanyl overdose situation, it can take numerous doses of naloxone to bring someone out of the overdose. However, appropriately responding to a fentanyl overdose would be no different from any other overdose situation. You would want to administer naloxone, rescue breathe, and make sure you call 911. After the individual has come out of the overdose, you will want to support them. Giving naloxone to an opioid-dependent individual can make them experience withdrawal symptoms. This will not be pleasant for them. However, naloxone does not kick opioids out of the body. It just kicks them out of the brain's receptor sites for a limited period of time.
If somebody takes heroin, and that's going to last where they say the half-life is, depending on what you read, say 2 to 4 hours. And then they have an overdose and they're not breathing. If they get naloxone lasts about 45 minutes, maybe an hour. And so that's the mismatch.
A lot of prescription pills are really similar, but things like methadone can be even upwards of 24 to 48 hours.
So the opiates tend to stay in the body longer. So it's really important with this medication that that person, once they get the naloxone, that they still seek emergency medical care.
There is the potential for somebody to slip back into an overdose after the naloxone wears off. More than that, the potential is with, when people use again after the naloxone's been administered, because maybe they are feeling a little bit withdrawal sick. It's really important to encourage people not to do that, because that's when the really big risk of someone slipping back into an overdose would occur. So.
If they don't know what it is and they're unresponsive, being able to use naloxone can make a difference, because it's not going to harm them by giving them naloxone if it's not an opioid. If they give them naloxone and they respond to it, then it was there. They had an opioid in their system. If not, it's also why we need to make sure that 911 is being called, because they need to be able to make sure that they are getting the medical attention they need.
In active addiction, we aren't trying to kill ourselves. We have a disease, we're sick, and every life matters is the biggest thing. And I needed to try multiple times before I could get better.
If we treated addiction the way we treat cancer or diabetes, we would see it very differently. If somebody in the community or the neighborhood, has cancer, people reach out. How can I help? Do you need to be driven anywhere? Can we bring you food? But when you say somebody in their family has a heroin addiction, it's like it's run the other way. We don't want to touch them. They're bad people. And that doesn't help families. It doesn't help people who suffer from addiction. It doesn't help people who are in recovery feel safe to let people know that they're struggling. And that's a barrier for so many people.
If we're going to take an approach that this is a disease, then we need to treat every person as if they're human and not just looked upon as a criminal. And so I think that's a really huge step. Everyone is touched by addiction in some way, shape, or form.
One of the things that we really struggle with in addiction is that we often have like flagship people, very strong supporters of other diseases and other community needs. But with addiction, historically in the United States, treatment has relied, at least in part, on being anonymous. So we don't talk about it. And a lot of times, in the treatment and in the recovery communities, there's still this aura of shame and guilt around having an addiction.
And there's really two things that go on. There's the person who has the addiction, and then there's the addiction. And we focus in on what the addiction does to people and the behaviors that they may be associated with, and not who that person is. So the more we can help people to understand and have compassion for addiction, for the disease that it is, and not shame and blame, the easier it's going to be for people to reach out for help.
If you use opioids or have a history of opioid use, you can and do contribute to society in numerous ways, one of which is getting trained to get a naloxone rescue kit. You are not the substances you use. You can save a life.